Good morning, everyone. Well, that worked. That's the first time Emily has ever listened to me this week. Good morning, everybody. Welcome. What an exciting week we've had at Princess Margaret, capped off by a great symposium today. I don't know, those of you who aren't working with us every day, yesterday we had our internal brand launch. Next week you'll see this externally on television, our new commercial and new brand. I'd like to start off with a land acknowledgement, just to acknowledge that the land we're meeting on today is the territory of many nations, traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabeg, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. And we also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. And thank you for allowing us to be here. Last year, or maybe 18 months ago, we launched a strategic plan called Always Moving Forward. And I was thinking about that this morning because one of the areas that we committed to do was to work with committed partners. And one of the themes of our work with committed partners was to allow us to deliver more cancer care at home, which is not really a luxury now, but more of a necessity and an imperative. We are always chronically short of inpatient beds. It's expensive to keep patients in hospital. The patient experience is improved by delivering care at home. And we're here today, I think, to hear from guests and partners from around the world who are committed to helping us find ways to better deliver care, and cancer care specifically, within the home environment. We're joined today by guests from the Mayo Clinic, from Sheba, who I'll tell you about in a minute, from Sheba in Tel Aviv. We're joined by a patient partner. We're joined by ex-employees of ours like Leslie Moody, who's currently working with Varian, but she's here to tell us in her own capacity about her interest in patient experience and patient care. We have with us members of the UHN Integrated Care Team, which will be very important in working with our home care partners in the community as we work this through. We're joined by some of our Indigenous health colleagues. I see Leonard at the back of the room there. Delighted to have them with us today. And we also have, I think, the entire cancer leadership team from Saskatchewan with us today, Wave. So if anything bad happens in Saskatchewan today, it's not our fault. So with that, let me start by introducing our first speaker. I had a really lovely day yesterday speaking to Eyal Zimlichman. Eyal joins us from Israel, and I'll just tell you a little bit about him. He's an impressive guy. So Eyal earned his master's in healthcare management at Harvard and his MD from the Technion Israel Institute of Technology. He decided to stay in Boston for a while, and he was working at the Partners Healthcare Clinical Affairs Department in Boston for a number of years, where he held the position as a lead researcher at Partners Healthcare Clinical Affairs. And he was involved at that time in strategic care redesign efforts in digital health. He worked clinically as an internist at Brigham and Women's Hospital and the Center for Patient Safety Research and Practice. And I believe at that time your focus was on patient safety and zero harm. Moving back to Israel, he became the Chief Medical Officer and Chief Quality Officer at Sheba, which is rapidly becoming one of the highly regarded and renowned medical institutions across the world. He's here today, though, in his capacity now as his new role as Chief Innovation Officer and Chief Transformation Officer at Sheba Medical Center, with a plan to redesign healthcare to be more patient-centric, effective, efficient, and equitable. He founded Sheba's innovation arm called ARC. ARC stands for Accelerate, Redesign, and Collaborate. And I believe, unless I get it wrong, there are now 9 ARC centers around the world in many countries. And in fact, to help accelerate that process, Spark has been formed, which is a school of training of entrepreneurism and innovation, mainly designed at clinicians who are close to the coalface of medical care. Spark schools will open in this year in Melbourne and Singapore, and maybe one day here in Toronto. So with that, I'd like to invite Dr. Zimlichman up to the stage to give us his lecture. Thank you.